this video, we will be doing the apical 4-chamber view of the heart. For this scan, we will be using the phased array cardiac transducer. A cardiac setting is used. As noted in the parasternal views, the cardiac setting results in the screen orientation marker being on the right of the screen. Once again, don't panic. This orientation is just convention for cardiac scanning. For this scan, the transducer orientation marker is now pointing towards the patient left. Screen right is therefore patient left. The depth should be set to approximately 20 centimeters. If, as is usually the case, this scan has been preceded by the parasternal short axis view, increasing the depth to 20 centimeters will be required. Greater or smaller depths may be required depending on body habitus. During this scan, we expect to see the following structures: a 4-chamber view of the heart, including the septum, the cardiac apex, the left ventricle, the right ventricle, the right atrium, the left atrium, the mitral valve, and the tricuspid valve. Okay, so now we're ready to start scanning. The transducer is placed in a rib space close to the apex beat. This will usually be in the 5th or 6th rib space in the mid-clavicular line. Slide the transducer cranially or caudally to find the best rib space. Then slide the transducer medially or laterally within that rib space to obtain the best view of the apex. Once the apex is viewed, rotate the transducer slightly, either anti-clockwise or clockwise, to view both ventricles side by side. Slowly tilt the transducer, either anteriorly or posteriorly, to ensure all 4 chambers are viewed. At this point, the depth can be adjusted if necessary to ensure that the atria are also visible at the bottom of the screen. Optimizing the image will require very fine movements of the transducer. Small adjustments to transducer slide, rock, tilt, and rotate can be used to generate the optimum image. In some patients, it may be necessary to roll the patient onto their left side to improve the image. Also note that image quality may change during the respiratory cycle. This completes the apical 4-chamber view.